So disturbingly, we saw 478 locally acquired cases of COVID to the 24 hours to 8 p.m. last night. Too many people are infectious in the community, and it is critical that we all heed and take part in the actions we're required to undertake. Stay home and leave your home for the most minimum of time, and every time you're out and about, assume you have the infection or that you will come in contact with anyone else that may have the infection. It is critical that we protect ourselves and our loved ones from COVID. I'm particularly concerned at the moment around Dubbo and the impact COVID is having on Aboriginal communities in Dubbo, and also that the fact that Aboriginal vaccination levels are not as high as I'd like to see them. So just to be aware that we are working with the Commonwealth to increase opportunities for vaccination in impacted areas in Western New South Wales. Also, I want to just advise people that even if you're immunised, fully immunised, you still have to follow all of the rules. I also just want to reflect on the deaths. And we have the deaths of 7 people reported. And it is important that we understand the true impact that COVID is having on the community and why it is so critical we all play a key role in protecting our loved ones from disease. There was a man in his 80s from southwestern Sydney died at Campbelltown Hospital. He was not vaccinated. There was a man in his 40s from southwestern Sydney who had severe underlying health conditions and was not vaccinated. A woman in her 70s from Sydney's northern suburbs died at Royal North Shore Hospital. A woman in her 80s from Sydney's inner west died at Royal Prince Alfred Hospital, and she was a resident of the Wyoming Residential Aged Care Facility and is the 3rd death list linked to this cluster, and she was unvaccinated. There was a man in his 70s from southwestern Sydney and he died at Liverpool Hospital, and he was a patient on the geriatric ward at that hospital and was the 8th death linked to that outbreak. He had had 1 dose of AstraZeneca. And a man in his 80s from southwestern Sydney died at Campbelltown Hospital and he was not vaccinated. He had a number of comorbidities that sadly contributed to his death. There was a man in his 80s from Western Sydney that died at Nepean Hospital. He was not vaccinated. He also had severe underlying illness. There was a young boy, tragically a 15-year-old from southwestern Sydney, died at Sydney Children's Hospital. I can confirm that he died from pneumococcal meningitis. He also was a COVID positive case. He had been vaccinated against pneumococcal disease as a child, had received some vaccines, but it is important to know that the vaccine may not have covered the particular strain that was involved in his death. The death of anyone is tragic, and it stresses the gravity of the situation that I've announced those seven deaths. And can I extend my personal sympathies to the families and friends of the patients. In terms of Nepean Blue Mountains, we have seen no new cases at Nepean Hospital, but we have seen about 30 cases across the Nepean Blue Mountains Hospital across 2 different exposures. There has clearly been an outbreak in the mental health facility there, and also across some other wards in Nepean Hospital. I just want to confirm that Nepean Hospital, including emergency department, remains open, and all precautions have been put in place to protect both health and staff and the health of patients presenting to that facility. In terms of sewage surveillance, we have had sewage indicating the presence of the fragments of the virus in the sewage in Burke, Lennox Head, Parkes, Wallacia sewage treatment plants, and we have not had identified cases in those facilities. So again, we need to be cautious everywhere at this current time. My final note is around vaccination, and it's amazing to have you here to talk about the grassroots initiatives you're putting in place to vaccinate the community. But it is so critical that we take up the opportunity we have, which is to get a vaccine. Also, I do want to be clear that vaccines take a while to work, 2 to 3 weeks, and also that 2 doses is better than 1. So please do not put off having your second dose of vaccine. Please come forward and get your second dose as well promptly. In relation to the AstraZeneca, we're advising that that interval be brought forward in that range of 4 to 6 weeks, and talk to your GP if you've had it prior to that and are due for your second dose. Thank you.